All right, we're going to go ahead and get started. So, hi everyone. Welcome to the One Health Academy. Thank you so much for joining us this evening, afternoon, morning, wherever part of the world you're joining us from. Um, Welcome back. We are very excited to have our speaker for tonight, Dr. Mike Wimberly. So, before I go into introductions, my name is Laura Budd. I'm the director of the One Health Academy, and I just want to welcome folks that are new. This will be an hour-long discussion. And for anyone new and or returning, just a reminder about the GoToWebinar platform. We ask folks to please use the question section of the webinar feature instead of the chat to ask your questions for Dr. Wimberly tonight. I'll do my best to moderate, and if it's a good time, I can let them know about your questions. Otherwise, we'll take questions at the end. We'll have the majority of the time tonight together based on the discussion and have some time for Q&A at the end. And so if you're having any sort of audio issues, please reach out. But without further ado, I'll go ahead and get us started so we can maximize our time together. Tonight, I have the pleasure of introducing Dr. Mike Wimberly. He is a professor in the Department of Geography and Environmental Sustainability at the University of Oklahoma. And his research explores the impacts of changing climate and landscapes on ecosystems and human health, with an emphasis on developing spatial decision support tools to support public health decisions, as well as land use planning and natural resource management. And he addresses these topics through landscape, regional, and global analyses using satellite remote sensing and other sources of environmental monitoring data. His research interests include the effects of environmental change on vector-borne disease outbreaks, the influences of human land use and wildfires on forest landscape dynamics, the impacts of agriculture expansion and intensification on native ecosystems, as well as the development of computer software for disease outbreak forecasting and landscape change modeling. So, without further ado, I'll pass the mic over to Dr. Michael Wimberly. Thank you.
Thanks for that introduction. And hello, everyone. Hope you're having a good Wednesday evening. And I'm just going to, jump in here. And tonight, I want to share with you some of my research on an area that I think of sometimes as One Health Informatics. So using Earth observations, geospatial environmental data, and connecting it with public health surveillance to forecast disease outbreaks. I'm going to talk mostly about mosquito-borne diseases, so I'm going to give a quick background on that. I'm going to focus most of the presentation on some of my work with West Nile virus outbreaks in the US. I think that's a good fit for the One Health theme. Looking at data and methodology, the types of models we use and how we apply them, and then also touch really briefly on a couple similar examples, doing high resolution risk mapping for West Nile, and also extending some of these approaches to malaria in Africa. So mosquitoes, this is something a lot of you have probably heard before. They are the most deadly animal on the planet. They kill more humans than any other animal, including humans, and you have to be pretty bad to do that. Just a couple of points of information here. There are thousands of mosquito species out there. But there are really only a small number of these that transmit diseases to humans. They're all around the globe. They need blood meals from a variety of hosts, which include humans, and that is it's through those blood meals that they can become infected and transmit infectious diseases. And most species feed selectively on a narrow range of host species. And mosquito-transmitted diseases have been important for a long time. Some of our cultural icons, like Dr. Seuss, for example, on the right, actually got his start writing, among other things, brochures for malaria prevention during the Second World War. There's also an old Walt Disney cartoon on malaria prevention, which is an interesting historical artifact if you ever want to Google that up on YouTube. So and the mosquito-borne diseases, they're very different, almost as different as the mosquitoes. So malaria, is really an ancient disease. It's been around so long that aspects of human evolution have been shaped by our exposure to malaria. But as you can see in the graph here, over the past century, and particularly in the past few decades, there have been, for a variety of reasons, there have been huge reductions in the extent of malaria transmission and the numbers of malaria cases that are occurring throughout the world. At the same time, we've seen other diseases rising up and emerging across the globe. And dengue is the classic example of that, where we see, really just in the past few decades, we've seen massive expansion of this pathogen across the globe. And, for all of these, no matter which type of disease we're looking at, there's a real need for more and better information that can help us control and hopefully eliminate some of these diseases. And, we have a variety of sources, disease surveillance of human disease cases. Commonly, there's surveillance of mosquito populations, testing them for various diseases. We can also monitor a wide variety of environmental risk factors, and those include aspects of the physical environment related to climate, vegetation, and land use, also the social environment, other aspects of the social context that can affect vulnerability to disease. And so to use this information more effectively, we're using mathematical models to try to synthesize it and predict things, address questions like where is malaria or other disease risk going to be highest? When are outbreaks going to occur? And also, how can we devise various types of interventions that can affect the transmission of malaria and other mosquito-borne diseases? So the first example that I want to dig into here is West Nile virus. So West Nile virus is the most important, the most widely transmitted mosquito-borne disease in the US. It's a prototypical emerging infectious disease. There was none of it in the US before 1999. Many of you probably know the story. First arrived in the US in New York City and has since become endemic throughout all of the 48 conterminous United States. One of the national hotspots for West Nile virus is actually, kind of surprisingly, the Northern Great Plains, particularly South Dakota. And so this is, in South Dakota, there have been, there have been more than 2,300 cases reported since 2002. That includes more than 500 severe neuroinvasive cases, almost 40 deaths. When you look at that in a state that has less than 1 million population, that's a pretty big incidence rate. So 20 out of 100,000 people in South Dakota get West Nile virus every year. So it's an important disease there. And the other challenging thing is there's huge interannual variability. So for example, we had 2 cases in 2011 and then 200 cases in 2012. And this makes it challenging to figure out how to allocate resources for prevention and control programs. As with many types of mosquito-borne diseases, and let me just go ahead and get this all out here. One of the things that affects transmission of West Nile virus and can account for this variability in space and time is environmental factors. So if we look at aspects of the weather, temperature, precipitation, and we look at, so we've got kind of our classic kind of One Health relationship here. We've got the environment, we've got mosquito vectors. This is a vector-borne and zoonotic disease. So we have avian hosts a variety of bird species and their habitats. So the virus is maintained in an enzootic cycle. Essentially, it's primarily a disease of birds, but in certain places and times we see spillover and transmission to humans. Now, how does weather come in? Well, the mosquitoes are these tiny ectothermic organisms. They're at the mercy of the ambient temperature. So every type of vital rate that happens inside a mosquito, including the development of the virus, is really sensitive to temperature. Birds can be sensitive to temperature too, particularly heat waves and droughts can impact their populations considerably. When we look at temperature and precipitation, they also have strong effects on vegetation and water balance, and that influences the habitats for birds and mosquitoes. And if we look at this chain of causation, weather influencing habitats and birds and mosquitoes, and translating into influencing the rates of disease transmission, this all takes some time. So there's a time lag between environmental fluctuations and when we actually are going to see increases in infection rates and transmission to humans. And so, just as kind of a foreshadowing, you can think, well, if we knew what the key environmental triggers were and we could track them, maybe that would give us a little bit of forewarning of when and where we're going to see increased transmission to humans. But there's a catch. Actually, there are multiple catches. So the environmental variation is always important, but it's not the only driver of these disease outbreaks. So another important factor, for example, is endogenous processes, particularly immunity cycles in the birds. So birds get, they get infected a lot more than humans do. And the birds that survive develop a lifelong immunity. So if you have a couple of years of high disease transmission, you can build up that immunity in the bird population. And then even if, in the next few years, even if the environment's favorable, we may see less transmission of disease because of that high immunity. But birds don't live very long. So, those birds that have gained immunity are eventually going to be lost from the population, and transmission is going to increase again as a result. And this is something that's very tricky to measure directly, but it's the sort of thing we get a lot of information, direct information about these transmission rates by trapping and testing mosquitoes. And that's really the most effective way to monitor these transmission levels. So let me propose kind of a model here for transmission. And I'll put forth the idea that looking for a virus out in a landscape or the state of South Dakota is kind of like looking for a needle in a haystack. It's a tough job. And here I've talked about a couple of different approaches that we have. We can trap and test mosquitoes, or we can use satellites and other sources of information to monitor temperature, moisture, other risk factors. When we measure those mosquitoes, we get a pretty clear look at what's going on in a particular location. But we only can look at a small number of locations. So we have a very good idea of what's happening in just a few parts of that haystack. When we look at these environmental data sets, we can map the entire haystack, but they don't tell us the whole story. They only tell us the potential for transmission. So we get a little bit of a distorted picture. So the idea is that, well, maybe if we can put these together, we can reassemble a better picture of the haystack and get a better idea of where and when we're going to see the highest West Nile virus risk. And so this is how we do it, looking at it from a data standpoint. So let's say that we have, we want to make predictions, forecasts of West Nile virus risk in 2020. We've got mosquito infection data that's collected by various municipalities throughout the state. We have the NLDAS, the National North American Land Data Assimilation System. This is basically big gridded weather data sets that are developed by NASA. And we've got human West Nile cases. So this is our dependent variable. This is what we want to predict. There's other information we could potentially bring in, long-range weather forecasts that'll tell us something about how the weather is going to be in the future, as opposed to the recent past. And we feed all of these into a number of models. And I'm not going to go into, it's too late in the day to talk much about mathematical models, so I'm not going to go into a lot of details. But basically, if you look at the blue boxes and the dashed lines, what we do is we calibrate models based on historical data. So in this case, if we want to predict in 2020, we use our data through 2019. And then as we get new data, we collect it in near real time in 2020. We put it into the same models, use it to make predictions, and we can get things like maps of what counties have the highest risk of West Nile virus cases. We can extrapolate into the future throughout the upcoming West Nile virus season and predict how many cases we're likely to see. So, and again, I'm not going to dig too deeply into the models, but I'm just going to show you a little bit about, give you a little peek at how they work. So West Nile virus always has a very strong seasonality, and it's a tropical disease in a temperate climate. So here we're looking at South Dakota is in blue, and Louisiana, another state where we work, is shown in red. So in both of these states, typically we see cases starting to occur in June, peaking in late July, early August. So the beginnings of these seasons are quite similar. Things tend to drop off by September in South Dakota, but we tend to see a much longer and a slower decline in West Nile virus cases in Louisiana. So there's always this, this seasonal cycle that we see. These graphs show some of the relationships with two important predictor variables. So temperature is always a very important predictor, and vapor pressure deficit, which you can kind of think of as the inverse of humidity. The higher it is, the drier it is. And we model these relationships with what are called distributed lags. So we look at, so for temperature, does it have a positive or a negative effect if we're extrapolating 30, 60, some number of days into the future in terms of how it influences West Nile virus risk? So, and I'm not going to get into the details, but I think there's some interesting contrast between these states. So you can see I've got on both of these graphs, there's a 0 line. So above that line, we have positive effects of an environmental factor. Below it, we have negative effects. So in South Dakota, when it's warmer, we tend to see more West Nile virus transmission. When it's higher humidity, we tend to see, which is a lower vapor pressure deficit, we see more West Nile transmission, more cases. In Louisiana, it's kind of the opposite. We actually see more West Nile when it's cooler than normal and when it's a little drier than normal. And so that's an interesting contrast. We find different environmental influences in different places, but it actually makes sense if you think about the fact that Louisiana is starting out being quite a bit warmer and more humid than South Dakota generally is during the West Nile virus season. So, they're, in two different states, we see different types of environmental anomalies leading to higher numbers of cases. These are some examples of the types of outputs that we produce. So maybe start by looking on the right. So if we look at, in this case, 2016, we predict the probability of observing at least one West Nile virus case in a given county. So here at, in the spring, in late April, there's essentially no chance at all. We start to see some of these probabilities increase as we get into June. Here they're peaking in August, and then they decline again. And we can take this information, and again, so for any day, if we make a forecast in this case, where this circle is, if you look at the graph on the left, early July, we can extrapolate from this forecast date to every week in the West Nile virus season. So we can predict essentially what that curve is going to look like, how many cases we're likely to see over the course of the entire season. So here, black is the prediction compared to red, which is the actual cases that were documented after the prediction was made. So we've been using ArboMAP in South Dakota since 2016. And this, now that I'm going through this, I realize I've got quite a lot of flowcharts in here, which maybe isn't a bad thing, but this is another look at kind of the way that this modeling system works. So, we start with, if we're making predictions in a particular year, we take human and environmental data from all the preceding years and we fit a model. And then in that current year, like every week, we make forecasts. Every week of the season, which we call the forecast week, we make predictions for every week throughout the season. So in week 1, if you look here, you can see that the blue dot is all the way on the left. So we're at the beginning of the season and we push out our first prediction throughout the entire season. As we get into later weeks, we're accumulating more data. We have more weather data. We have more mosquito data. And what we expect is that as we get later and later into the season, these predictions are going to get better. And you can see that blue curve is kind of shifting a little bit as we move through the season. And then if we summarize some kind of a statistic of accuracy for every forecast week, we would expect it to generally increase throughout the season. So as with a weather prediction, our predictions get better as we have more and more data to go into that prediction. And so we actually have done this in real time for a number of years. To actually do a model validation, we sort of go back and rerun the model, similar to what's done in weather forecasting. As we're running the model, we tend to tweak it and mess with it and change things from year to year. So you lose that consistency, but we can go back and do these validation experiments where we look at various models and understand how well those predictions perform over this historical 4-year period. Okay, again, because it's a Wednesday evening, I'm not going to dig into pages of results. I'm just going to show you one little figure here that really kind of encapsulates our validation results. So this is what's telling us, with these forecasts, are they accurate? Can we predict anything? So what we have here is on the x-axis, these are the forecast weeks. So we're looking at the accuracy of forecasts made in different weeks of the year. On the y-axis is the area under the curve. And this is basically a measurement of how well our predictions match observations. And it's scaled it can take on values between 0.5 and 1. This dashed line here is what we call our baseline model. So if we just took, for example, the mean seasonal trend for a particular week from historical data, and the county level summaries from historical means, that's what we would predict. It doesn't change over time because we're not putting any weather or mosquito data into it, but this is kind of our baseline. This is, so we can actually do reasonably well with just, historical averages, because there's a strong spatial pattern that tends to be fairly stable. And that seasonality that I showed you is fairly constant from year to year. So basically, we've got to beat this prediction to show that we have forecasting skill. And just to point out that all of our models based on mosquito data in green, environmental data in red, and the combined mosquito environmental data in blue, they do all do better than that baseline model. Environmental variables do tend to do particularly well if we look very early in the season. So they do better than the mosquito variables, which is interesting. Overall, though, the combined model is more accurate than the mosquito and the environmental model. So this is kind of if you go back to that haystack slide, that's kind of a validation of our haystack hypothesis, that we do better by pulling in multiple streams of information and combining them. And the other important point is we reach peak accuracy actually pretty early in the season, in late June. So, we don't have to, we get the best prediction of West Nile virus, at least a month or two before we're expecting to see peak human cases. So this is just another look at what those forecasts look like. So this blue line, this is looking at predicted number of basically county weeks, number of counties times weeks with West Nile virus cases. And you can see that, the best combined model actually captures both the interannual variation and some of the seasonal variation in each year pretty well. With the forecast, which are here on the right, predicting ahead outside of our training data set, we can still distinguish years with high case numbers like 2016 and 18 from those with low case numbers like 2017 and 2019. And then these different colored lines are predictions made at different weeks of the season. So you can see, for example, in 2019, we start out at the very beginning, we're predicting kind of low, and that prediction starts to get a little bit better. It increases and gets closer to the eventual observation as we get more and more data into the system. So just some, a few points on implementation. We actually designed this so that it's not just an academic exercise. We designed this to be a tool that essentially anyone, well, not anyone, but it's designed to be usable by an epidemiologist working in a state public health department. So it's all implemented in the R language and environment in our studio, which is a freeware data science package. So it's a script that connects to various data sources and runs. We use, one of the biggest challenges is getting people in the public health field, providing them access to some of the, whoops, I think I've got something set in my PowerPoint that I didn't want to set, but I'm not going to go back and fiddle with it now. So we use a Google Earth Engine app. So this is a cloud-based app. Basically, it allows an epidemiologist to go online, indicate what state they're working in, what dates they need data for, and they can get the most recent weather data summarized by county ready to go into the system, which we call, I forget if I mentioned it somewhere, we actually call it, it's called ArboMAP. And then we have it set up so that it produces formatted reports. So it basically, when it runs, it spits out a PDF that has some auto-generated text, forecast, graphs, essentially intended to be a weekly report that can be generated. The state epidemiologist can look at it, can take figures or other information out of it, send it out to mosquito control districts. And we're currently doing this in 4 states. So this all started out in South Dakota, but we're now working in Louisiana. We have a partnership with Michigan, and we're working in Oklahoma as well. And so just as an example, these are some forecasts that we generated for some of our work forecasting for 2020 in South Dakota and Louisiana. Well, there's just one final thing that I want to say about this. And this is a question that I often get asked, and it's a good question. Like, why do you need to do this? What's the point? Does this, how does this actually help, us in terms of public health in the fight against West Nile virus? And the reason is that in particular in South Dakota, but this applies to many other states as well, the sources of information that we have tend to have substantial limitations. So one is that when we look at human cases, just because of the way our surveillance systems work, those reports are delayed by weeks or months. And so this is, if you look on the right, this is the story I always like to tell people. If you go back to 2018, we were sitting in July 26th. And in terms of the information that the State Department of Health had at that point, there were 8 confirmed cases of West Nile virus. So it was like, oh, it's a low year. In reality, there were actually 50 cases that had already occurred. And overall, this was one of the biggest seasons that we had seen in years. However, in early July, although we were looking at 8 cases, ArboMAP, our predictions were kind of going off the charts, predicting a higher than usual level of West Nile virus risk. And at that point, we had worked long enough with the State Department of Health that they had some faith in this and were willing to put the message out to municipalities that, hey, we haven't seen a lot of cases, but that doesn't mean that we're not going to have a lot of West Nile virus cases this year. The other thing is people tend to respond to mosquito abundance. If there aren't a lot of mosquitoes flying around, there's an assumption that you're not at risk of mosquito-borne disease. And that actually is not the case. In South Dakota, what we tend to see is if you look at this blue line, we see a huge spike in nuisance mosquitoes really early in the season. They don't transmit disease, and they actually start to decline at the time when Culex tarsalis, which is the main West Nile virus vector and isn't nearly as abundant, tends to increase. So as we go into the West Nile virus season, people are tending to see fewer mosquitoes around. They're getting fewer mosquito bites, and whether it's a city deciding to put money into mosquito control or people thinking about personal protective measures, people tend to let their guard down. So there's actually really a need to take the information, synthesize it, and really try to put together reliable forecasts of future disease risk.
Dr. Wimberly, there's a related question. Someone asked why the prediction is more accurate early in the season. Is that because there's less complexity related to mosquito populations later in the season, or more environment driven?
I think it's partly because it's a good question. We're not entirely sure. A lot of what's happening in the early season has to do with amplification in the spring and early summer. So before the West Nile virus gets transmitted to humans, it basically has to build up in the mosquito and the bird populations. And that tends to be happening in the early part of the season. And if you get a lot of amplification, you'll get a lot of human cases. If it doesn't amplify well because the early season conditions aren't favorable, then it's, you get into the summer and it's kind of too late to build that up. And I think that there are a couple of other technical reasons with the models why that happens, but that's kind of getting into the weeds. And I don't really want to get into it right now, but if someone wants to follow up, they're free to shoot me an email. And these are just, I just wanted to point out that this is, this modeling isn't something that we just threw together one weekend. We've been working particularly in South Dakota for a long time. So it's built on a lot of work that particularly my students and postdocs have done. So I just wanted to throw these out in case anyone wanted some further reading. And let me just touch on a couple other examples. So we've used kind of a similar approach to develop high-resolution risk maps. So here, the idea is that if we want to look at West Nile virus risk, we would like to be able to look down at a little bit finer than a county scale. Counties in South Dakota and other places are pretty big. So what we've done here is we've actually, as opposed to working with county level data, we have geocoded data on essentially the home locations of people who have gotten West Nile virus in South Dakota. We have some control points, population-weighted control points that we generate. And then we look at, again, various sources of environmental information, land cover and physiography, climate, spectral indices from satellite remote sensing, use a technique called boosted regression trees, and essentially use it to try to interpolate between these points and predict disease risk at a spatial resolution of 300 meters. So this is some of the data that goes into it. So these are the smooth patterns of West Nile virus cases. Because for privacy reasons, I can't show you the individual points because they're home locations. But you can see that, okay, these are the places where we tend to see concentrations of cases. And as you expect, those, these big blotches, if we just count the number of cases, are Rapid City, Aberdeen, Sioux Falls. They tend to be where the human population is. So if we control for population density, now we can get a smooth incidence rate, and we get a sense of where we're seeing some of these real hotspots in South Dakota. These are some of the important predictor variables. Elevation, relative humidity, again, is important. Satellite indices of wetness. These tell us areas that kind of pick out low-lying areas that tend to have a lot of wetlands. Areas that have pasture, precipitation comes in, as does soils that are particularly susceptible to ponding. And so this is what we get out of it. We can get, so by bringing in these environmental predictors, we can go from these smooth maps, which are based just on the cases, to a much more spatially refined prediction of where West Nile virus risk is highest. And the results, generally make ecological and epidemiological sense. So here in the Black Hills, as we go from the plains, we get up into the Black Hills, there's tree cover and gets cooler. So we don't see West Nile transmission occurring here in the mountains. Here, the James River Valley, this is a glacial lowland. This is our big state hotspot. But because Tarsalis is primarily a rural vector, we actually tend to see higher risk when corrected for population outside of cities. So you can see this little island here with lower risk. That's actually the city of Aberdeen. And where the risk of transmission is high is out in the more rural areas. Here, you can kind of see the part of the city of Sioux Falls in here, but what jumps out here are some of the landform differences. So this is a glacial land. We've got glacial moraine here to the west, which is poorly drained, has a high ponding frequency, and we see higher risk here than in the loess soils to the east. So risk mapping. And let me just quickly go through this last example. I want to make sure we have some time for questions. I'll just say that, we've also worked for a long time in Africa, doing similar types of forecasting work. There, we talked about the big declines we've seen in malaria cases, which have been great, but there are concerns because those declines have slowed in recent years. And there's a real push, for, again, better informatics, particularly predictive informatics, to support decision making and help to target malaria interventions and make them more efficient and effective. Here, just pointing out, this probably looks very familiar. We have to take out the birds with malaria because it's an anthropogenic disease, but we see a lot of the same temperature and rainfall effects influencing mosquitoes. Here, we're talking about a microparasite, not a virus, but again, similar effects on the mosquitoes, the parasite larval habitat, affecting transmission to the human host. And, so we've worked a lot. Ethiopia is another place that we've worked for a long time. These are, just to kind of give you a look at the lay of the land, this is district level incidence rates of malaria cases from 2014 to 2019. It highlights, as with West Nile and South Dakota, we see a lot of spatial variation in disease incidence. If we look at relationships with climate factors, we see a unimodal relationship with temperature. We've got an optimum temperature. We generally see higher malaria cases in wetter parts, and we see different types of trends. This is looking just over the past 6 years, but we've got a lot of places in Ethiopia where malaria cases are going down. That's great. But there are other places where we've seen recent resurgences, particularly in 2019. So, there's a lot going on, and there's a need for, similar types of predictive analytics, like we talked about with West Nile virus. And, again, I'll spare you the details, but we've developed another forecasting system that we call EPIDEMIA, that's tailored to malaria. And it basically puts together epidemiological data that's collected by public health agencies in Ethiopia, again, using Google Earth Engine which has been really helpful for allowing public health professionals in low bandwidth environments to use the cloud to process and access these environmental data sets. And, again, similar to ArboMAP, we've got R scripts, they run and they automatically generate reports. Here, we work with NASA Earth observing satellites. They're, for working in Africa, they're really our best source of up-to-date, high-quality environmental observations related to temperature, precipitation, and also a variety of greenness and moisture indices. I guess I already said this, but Google Earth Engine has been really a critical tool. And again, as with the West Nile virus example, our goal here is to actually is not to do this ourselves, but to come up with tools that can be owned and used by by public health institutions in Ethiopia, so that they can eventually own the entire process. Some of the things we do, we generate alert maps. So we can we work with early warning, which is based on predictions up to 12 weeks in the future, based on relationships with environmental variables. We also do early detection of outbreaks by looking at case data from preceding weeks. So this is the Amhara region. We generate maps identifying where we have alerts in the entire region. Then you can zoom in to these districts. So this is Bahir Dar Zuria, which you can see is popping up as red in the maps. And then an analyst can zoom in. They can look into the future and see, oh, okay, if you look at the vertical lines here on the top, we're predicting for Plasmodium falciparum essentially above normal numbers of caseloads going out into the future. We can look also at the historical context. Here, looking back into the rainy season, we can see that there was a lot of excess precipitation, followed by a drier period, potentially a signal of increased environmental suitability for malaria transmission. And just to point out that this is something that we've again worked on for a long time, but I just want to point out that there are a lot of other people who have been a part of this and supported it, and it's been a big project, and it couldn't have been done without support from all of these individuals and institutions. And here's some papers that you can read. We do have the most recent project that we've had has been with USAID, and we spent the past 2 years developing, building on some of the preliminary work we did in Amhara and developing a roadmap. So, what I think is actually the first set of guidelines or plan for taking these early warning approaches and scaling them to a national level in sub-Saharan Africa. And that, for those of you who are familiar with the USAID reports process, it's kind of slow, but that if anyone's interested in this kind of stuff, ping me and I'll send you a copy when it's officially released, which should be any day now. So let me just wrap it up here. Kind of going back to what I talked about most, forecasting seasonal West Nile virus outbreaks. What have we learned from this? Combining multiple data sources is the key to getting good predictions. Again, it's the haystack. It's like the Reese's peanut butter cup of predictions. You need your peanut butter and your chocolate to get what you want. In this case, these data sources are complementary, and they're what allow us to get predictions that are reliable enough to actually be usable for public health purposes. We can come up with predictions that have skill. They're better than baseline predictions based only on seasonality and location, and we can get good accuracy early enough in the season to allow time for prevention and control. And then I think the other point I want to make is that this basic approach can be extended to other applications. I've talked about risk mapping for West Nile, malaria early warning. There are many other people working in this space these days in different locations with different types of diseases and applications, and I think that's great. And oops, I will end with that, but I'll try to leave this up here. That's my contact information if anyone wants to follow up, and I'm happy to answer some questions now.
Thank you so much, Dr. Wimberly, for such a great presentation. I love the flow charts and the figures, so thank you for all that visual aid. But yeah, I'll open the floor for questions, and while folks are doing that, please put it in the question section. But yeah, I just wanted to say, if we were hosting you in person here in DC, we would be gifting you a flag flown over the Capitol as a token of our gratitude, but unfortunately, we are not right next to each other, so I apologize. Feel free to send an address if you'd like me to ship that to you. But yeah, super grateful for your time, and thank you for sharing all this insight with the community. So I am seeing some questions come in, so let me go ahead and open those up. Just one of gratitude. So yeah, that was so interesting. Thank you. So excited to see what can be done. And Deborah also loves the flowcharts. So thanks for that feedback and that comment. I'm wondering, just while folks are taking time to write questions, I'm from Florida. I was curious, how much work in the future do you see expanded to different states, and kind of your own personal work? I mean.
I mean, I think there's a lot of potential. I mean, we've
Mhm.
gone from, we started in South Dakota, and then I should also point out that the West Nile research has been supported by the NASA Health and Air Quality Program, which is very focused. One of their goals is to not just fund scientists to do research and publish papers, but develop usable tools. So part of the objective there is to develop a tool and get someone to use it. And so we were successful in South Dakota. We had some connections in Louisiana. We went there next. I moved to Oklahoma a few years ago, and we made connections here. And then through people we met at another meeting, where we've started working with Michigan. But I mean, I will say I'm not the only one who does this. That they are. I think we do a particularly good job of this, but there are people in other states, other institutions who are in the disease forecasting game. So I mean, I wouldn't be surprised. I mean, and particularly because mosquitoes are a big issue in Florida. I guess interestingly, West Nile is less important in Florida than in many other places, but there, because you have other mosquito species like Aedes aegypti, there's always concerns about local transmission of dengue or Zika. So I mean, I do know that I don't know that there's much West Nile work going on, West Nile forecasting work going on in Florida, but people certainly work on some of these other diseases. And yeah, I mean, we're always, again, we have the software. If there's anyone who's out there, or of someone who works in, a state public health agency who, is interested in doing something like this, feel free to connect them with us, and we're happy to share the tools.
Absolutely. Thanks. I didn't mean to target it to Florida. Just, no, mosquitoes are a hot topic there, which is a good segue to our next question. Very topical right now. What are your thoughts on this effort to release sterile mosquitoes to wipe out the disease carriers? The diseases were huge, of course, but on the other hand, mosquitoes are an important food source for aquatic species. And if you don't feel comfortable um, uh, sharing your opinion, no problem.
No, that's fine. It's a good question. Yeah, I mean, I don't know. I mean, certainly, I think there's potential for that approach to be successful. I mean, there have been other, I guess like screwworm eradication, for example, which was focused in Florida. It's not exactly the same, but it's kind of a similar, approach, and that was successful. Although, I mean, my sense is that it's, and again, this is just a guess. My sense is that it will have some effect. It will have the potential to, it'll have the potential to reduce some mosquito species, which is good. I don't think, I don't think it's going to eradicate them or necessarily impact them that much more than, some of the other pretty intensive locally intensive mosquito control approaches that we use. I mean, I guess at this point, I think it's a good thing, because I think with these mosquito-borne diseases, we don't really have any silver bullets, and for a variety of biological and ecological reasons, I don't think that any insecticide or particular treatment with sterile mosquitoes is going to be the silver bullet. But I think it's probably good to have another tool in the toolbox, and hopefully we'll figure out when and where it's most effective and appropriate to use.
Thank you for that. We do have another question asking about, are you working on malaria forecasting for the Grand Ethiopian Renaissance Dam in Western Ethiopia? Is the dam agency cooperating or a partner?
No, I mean, we are, I mean, we're not specifically working on that. So, I mean, I can't say that the dam agency isn't really cooperating or non-cooperating. We're working with the Federal Ministry of Health and, you know, the Ethiopian Public Health Institute. It's an interesting question. You know, we do, you know, I'm glad someone mentioned that, because it would be interesting. I think we should have some data from that part of the country, and we could go take a look at it. Dams are an interesting question. I know just a, you know, kind of a corollary. I actually have a student who's just finishing up revisions, or she just finished up revisions on a paper where we looked at kind of in close detail at a couple of districts in the Amhara region, one that has a dam and an irrigation scheme. And, you know, in that case, we didn't find negative effects of the dam or of irrigation. And there are a couple of reasons for that. I think that there's an old paper called The Paradox, where they talk about the paradox of the paddies, which, you know, is basically about how, depending on the context, dams and irrigation can increase malaria transmission by essentially increasing mosquito breeding sites. Or, you know, in some cases they have no effect, or they've been found to decrease transmission. And often that's through, you know, indirect effects of economic effects of irrigated agriculture, leading to, you know, greater wealth of farmers, better houses. You know, in the case of Amhara, they actually, I think, did a good job of designing this irrigation scheme, in that they didn't build houses in the middle of it. The houses tend to be clustered away from where most of the irrigation is. So it's a great question. The short answer is, I don't know. But yeah, I'm glad the questioner brought that up. And I think there might be some ways we could look into that.
Thank you. That's all the questions I see, and it's kind of perfect timing because we're being extremely punctual this evening, so I won't push us over, but just want to use the last minute to say, really, thanks so much, Dr. Wimberly, for your time, for doing this important work, for sharing it with the One Health community and framing it as One Health work, because I think that is half the battle. So thank you for being a One Health advocate, and seeing a lot of thank yous and appreciation in the chat and question box. So please definitely feel free to join us in the future. And for folks on the line, yeah, definitely reach out if you have any questions based on the contact information, Dr. Wimberly. And grateful for all of you joining us this evening and sharing some time. I know there's a lot of webinar fatigue, so thanks for hanging in there on a Wednesday night and or morning, whatever time in the world it is for you. Webinar is recorded if you'd like to see anything again, and we look forward to see you probably in July with the next speaker. So thanks, everyone. Have a really enjoyable rest of your spring and summer, and we'll talk to you soon. And thanks so much again, Dr. Wimberly.
Yeah, thanks everyone for coming. Have a great evening.
Thanks, guys. Have a good night.